do you know if you're developing a pelvic floor or pelvic health issue? How do you know if you need to come in for treatment? Sometimes it's difficult to understand what's happening with our bodies, especially in a place that's as private and sort of mysterious as the pelvis and the pelvic floor. Here are the things that you can look out for that will let you know your body is asking for help. It's time to come in before a larger problem develops. 1, issues with urination. Now that may mean leaking. That's super common. We see it all the time. That might mean difficulty emptying. That might mean frequency or urgency, having to go more often than you used to, or having a stronger urge than you used to, or having difficulty controlling that urge. Could also mean having difficulty even initiating the stream or feeling like you didn't quite empty all the way. When you feel any of those symptoms happening, if they're happening at all consistently, we recommend that you come in because that's indicating that a pelvic floor problem is developing. 2, problems with defecation. That often presents as constipation, but it could also be new onset of hemorrhoids. It could be needing to strain more than you used to. It could be fecal smearing or incontinence, meaning you feel like you're never quite clean or there's always a little something there, issues with hygiene. Anything in the realm of fecal incontinence, hygiene issues, anal fissures, hemorrhoids, or constipation, we definitely recommend coming in for a checkup to make sure that there's not a muscular component at play. And 3rd, sexual issues. If you are having any changes in your sexual function, whether it's hormonally related or you don't know the cause, it could be that lubrication is decreased, it could be the muscles are getting tighter, it could be that climax is more difficult to achieve. Any change or disruption in your sexual function could be an indicator that you need to come in for a pelvic floor checkup or a pelvic health checkup. And then the last broad category, of course, is reproductive issues. If you are anywhere in those stages of reproduction, fertility, pregnancy, or postpartum, we always want you to come in. You don't necessarily have to have a problem for us to be able to help you and facilitate you and make sure that you're safe and happy and healthy and living your best life through all those stages. And then, of course, I will just say pain in the body is never normal. If you are having pain outside of the things that we've talked about, whether it's pelvic pain, sacroiliac, low back, certainly we mentioned painful sex, that could present as painful menstruation. Anywhere pain in the pelvis, low back, anything in the hips in that system, we can work with that and we would want to check it out to make sure there's not a pelvic health component at play.